You do not want to work there as a new grad. When you're a new nurse, you don't know what you don't know. It's under fire because they can't keep their nurses. So the most important question you need to ask as a brand new nurse. Hi guys, my name is Jodi. I've been a NICU nurse for over 2 years, and in this video I want to share my 3 main tips on how to choose the right new grad residency, whether you're going to the NICU or any other specialty, or even if you're going to med surge. I've made so many mistakes, and the reason why I'm making this video is because I just see time and time again where new grads get trapped into working for horrible units and horrible hospitals, and I'm going to share my 3 biggest mistakes in this video. So keep watching if you want to make sure that you choose the right NICU residency for you and you don't get burnt out during your first year as a brand new nurse. You need to watch this video because I'm going to give you main questions you need to ask during your interview, things you need to look out for to make sure you are not being trapped into working for a unit or a hospital that is under fire. When you're a new nurse, you don't know what you don't know. You don't know what's normal and what's abnormal because this is your very first real nursing experience. This is your very first nursing job. So you don't know what's normal and what's abnormal. You don't know what it should be and what it shouldn't be as a new grad, okay? So for me, I was burnt out. I didn't even know I was burnt out. I just know I was crying every single day leaving work. I was miserable. I didn't want to go to work. I had severe pre-shift anxiety, just shaking, not knowing what I was going to expect. Your new grad residency is your very first introduction to what it's like to being a real nurse. This is your foundation. Okay, and if you build on a very unstable foundation as a nurse, that will affect your patient care. So the very first thing I want to talk about is choosing the right NICU residency. How do you go about choosing the right residency? You are in your senior year of nursing school, and now it's time to apply to these different hospitals, apply to these different new grad residency programs. Where do you go? Who do you choose? My main thing was I did not want to work for a unit that had a high turnover rate. I didn't want to be burnt out. I didn't want to work for a unit that was under fire. That's what I call it. It's under fire because they can't keep their nurses, okay? So the number one mistake I have seen new grads make when choosing a NICU residency is not asking the right questions during your interview, okay? There are specific questions that I think you need to ask your interviewer to know exactly what's going on that unit. You need to know, is this unit desperate for nurses? Because if they are, you do not want to work there as a new grad. It is going to be very overwhelming, very stressful for you, and that was my experience. And I didn't ask these questions. Now that I'm in my second nursing job, I made sure to ask all these questions during my interview. And the thing is, when I asked these questions, they actually liked me more. They told me I asked really good questions, and that's one of the reasons why they hired me, because it shows that you have done your research. It shows that you are asking insightful questions. The most important question you need to ask as a brand new nurse during your interview is, what is the current nurse turnover rate? This is a really important question to ask. Why? Because knowing the turnover rate on the unit will give you a sense of how fast they're losing nurses. And a unit or a hospital that is constantly losing staff nurses is not a good place for a new grad. I don't care what anyone says. I don't care if they say this is the best hospital to work for in your city. If they have a high turnover rate, you don't want to work there. You're going to be stressed out. You're going to get some of the worst patient assignments. You are interviewing them just as much as they are interviewing you. And you need to make sure this is a place that is conducive to teaching and training a brand new nurse. And even if you are an experienced nurse and you're changing specialties to go into the NICU, this is very important to ask as well, because just because it's the NICU doesn't mean it's going to always be glitz and glam. Every NICU isn't made equal. Every NICU isn't the same. So you want to make sure that you're not working for a unit or a floor with an extremely high turnover rate. So from my personal experience, my first new grad residency was on a unit with a 90% staff nurse turnover rate. And it showed. It showed in the patient assignments I was getting. It showed in the patient ratios I was getting. It showed all around because I was burnt out. I was miserable. I thought I had made a mistake going into nursing, but really and truly, it was just that unit. Don't be afraid to ask these questions because this is for your own livelihood. A big issue with having a high turnover rate is the fact that there is no consistency in the standard of practice, and that this will increase the chances of mistakes being made. This will increase the chances of people and new nurses being incompetent and undertrained. Another follow-up question that is good to ask that will give you a sense of what's happening on the unit, and this will also give you a sense of the turnover rate or nursing retention, is asking the question, how many travelers do you have on the unit at a time? This is not to say travel nurses aren't competent, because the fact that you're a travel nurse means something, okay? You have enough expertise to deal with the ebbs and flows of travel nursing. With travelers, their assignments are only 3 to 6 months, and if they renew their contract, it might be longer. So still, you're having this extremely high turnover with staff nurses, with travel nurses, and that can be very detrimental to a unit. And this is not to say travel nurses are incompetent or travel nurses aren't great nurses, because some of the best nurses are travel nurses, right? However, it reflects the conditions of the department, not the individual travel nurses. It's just giving you an insight on how bad or how good this unit is able to retain nurses. And if they can't retain their own nurses, that's a bigger problem. Why? Why is everybody leaving? And people leave units for a host of different reasons. They might go traveling for more money. They might be going back to school. Nurses are the backbone of our healthcare system. And so if a department or a hospital has issues with nursing staff, you do not want to work for that hospital, point blank, period. But at the brink of it, there's still a underlying problem of this unit, this department, or this hospital not being able to retain its staff. There's a reason, right? And if you want to go find out what that reason is, that's on you. But if you're anything like me, if I had known, I would not have wanted to step foot on the NICU I did my new grad residency. Still to this day, I am still traumatized from the first hospital I worked for. It was 9 of us that started together, and after a year, I believe it was only one new grad in my cohort that was still there. That's how bad it was, okay? And when you see that happening within a year, you have lost all 9 of your staff nurses. If you see that, that is a much bigger problem beyond you. And you as a new grad do not want to work for a NICU, for any department with such a high turnover. So another major mistake that I see a lot of new nurses make is the fact that they get caught up on the name of the hospital, okay? Just because a hospital has like a very prestigious name, or it may not even be the hospital that has a good reputation, but it is the school that's affiliated with the hospital. A lot of times you make the decision to work for a hospital or a unit because of the name. And that's the first thing you're going to realize as a brand new nurse. Do not chase after a name like, oh, you're John Hopkins or Texas Children's or Children's Healthcare of Atlanta, does not mean that hospital or that facility is a good place to work. They may have some of the worst patient outcomes, worst nursing outcomes. Okay, so that's the second mistake that I see a lot of new grads making, is getting all caught up and gung-ho about the name of a hospital just to say you worked for, I don't know, Boston Children's or John Hopkins Children's or whatever. Do not get bamboozled by the name of a hospital. Okay, the hospital might be affiliated with the university, which is great. The university has that reputation, but that hospital may not be all that it's cracked up to be. And once you get there, you realize that this is low-key ghetto. Okay, this is low-key ghetto. Please, 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 this is how a lot of new grads get trapped. And in addition to not getting caught up on the name of a hospital, some of these units will ask you to sign a contract. Do not ever sign a contract. Do not trap yourself at any of these facilities. I promise you. Luckily I did not sign a new grad contract. I didn't sign a contract, but I had nurse friends that did sign a contract. Unit was literally under fire. They couldn't leave. But after a year, I got up out of there. Okay, I need you to be confident, and I need you to stand up for yourself even before you get to the unit. Yes, you're a new grad. You might think you don't have any leverage, but you need to remember, they need you more than you need them. They need you, okay? They can't function without you. So stand up, stand firm, know what your boundaries are with some of these hospitals and some of these facilities. Don't ever sign a contract. Don't get caught up on the name of a hospital. And this is specifically for NICU nurses. This is specifically for any new grad or any experienced nurse who want to become a NICU nurse. When you're looking at your NICU residency, you are choosing your NICU residency, research different level NICUs. And you need to decide as a brand new nurse if you want to start at a level 3 NICU or a level 4 NICU, right? Obviously, apply everywhere. You should have already done your research and know that there are different level NICUs, right? It's level 1 through level 4. I heard there's a level 5 somewhere, but I don't know where that is. But level 4 is the highest level NICU. And this just means that's the last resort for a neonate or a newborn if no other NICUs or hospitals can take care of them, right? Level 4s are going to be the most equipped with all the latest technology, the most advanced practitioners to help care for the most critically sick infants or newborns, right? I was trained at a level 4. I did my NICU residency at a level 4, and I still currently work at a level 4 NICU. A level 3 NICU can do a lot of what a level 4 does. However, if a level 3 NICU cannot stabilize or take care of that infant, and a lot of times level 3 NICUs, they don't perform certain surgeries, they send them to a level 4 NICU. However, as a new grad, you need to decide where you want to get your foundation as a NICU nurse. You need to really assess your personality and what kind of person and what kind of nurse you think you are. I know as a new grad this is really hard to do because you don't know what you don't know, and you don't quite know what you like and what you don't like. So a lot of level 3 NICUs are birthing hospitals, and you will see a lot more level 3 NICUs than you see level 4 NICUs, okay? So the majority of NICUs are level 3s, and there are only a few level 4s because they deal with the most critical babies. You assess your personality. If you're someone that likes a lot of adrenaline, I can't speak, y'all. If you're someone that likes a lot of adrenaline, if you get bored easily, if you like to get a lot of admissions, then working at a birthing NICU will be beneficial for you. There are some level 4 NICUs that are not birthing hospitals. So like my last hospital, the mothers did not give birth there. You also want to make sure and ask during your interview to ask them what kind of patients should you expect to see as a new grad nurse on that floor. So if you like to get admissions, if you are someone who gets bored with stability and you like a lot of changes throughout your shift or throughout your day, you might want to consider a level 3. Also, there are a lot of nurses that just like the smell of newborn babies. I like the smell of newborn babies. I don't like to get a lot of admissions. Admissions are not my thing. I don't like it. It's too much instability. Like, I don't know what's going on with the patient just yet. I kind of like to come in, have a stable patient, know what's going on with my patient throughout the shift. I like to know what to anticipate throughout my night. Okay, that's not to say I don't get an admission every now and again. I do. However, if I prefer not to do a lot of admissions, but that's just me. I like stability throughout my night. Being a nurse in and of itself, it's super unpredictable. That's the word I was looking for. Being a nurse is already unpredictable. I don't like to come in and not know what's happening on my shift, so I don't like to get a ton of admissions. So a level 3 NICU would not be for me. Okay, I don't like to deal with laboring. I don't like to deal with the labor part of anything. As a level 4 NICU nurse, you also might like the adrenaline as well, because those babies are extremely sick. So you get a lot of adrenaline from those unstable patients as well. So that, to me, that's the main difference. You could start at either or. You're still going to get critical care experience. Just for me, I knew I wanted to be able to take care of the sickest of the sick, so that's why I went for a level 4 for my new grad residency. But if you want to kind of ease your way into the NICU, I would highly suggest starting at a level 3 and get your feet wet, then move on to a level 4. If you're an all or nothing type of person, kind of like me, go for a level 4. Just make sure you vet the hospital and the unit that you're going to work for, and make sure that they are not desperate for nurses and they are not losing nurses consistently, and they have an issue with staffing, because that is going to make or break your new grad experience. That will increase your chance of burning out. This will increase your chance of leaving the nursing profession in general. And I want you to have the most dynamic new grad experience. I want you to have a great NICU experience. Being a NICU nurse is the most rewarding thing. I would not have chosen any other specialty, but you have to do your research, and you have to do the work and ask the right questions during your interview to pick the right hospital and the right unit to work for. And I think that alone will help you have the most vibrant and rewarding new grad experience, and help you just enjoy being a nurse more. So stay tuned for more tips and tricks on how to be a NICU nurse.